Hello, everybody. I am very excited about this talk. Today, I have Kristen White with me. She is a registered dietitian, and we are going to be talking about gut health, which is a very exciting topic and one that I'm very interested in learning more about. So, we're all going to be learning some today from Kristen, and I'll start by letting her introduce herself.
Hello, everyone. I'm very happy to be here. And I'm a registered dietitian, also CLT, certified LEAP therapist. I specialize in food sensitivities. I have my own private practice called the Food Sensitivity Dietitian. And so the goal that I always have with my clients is to decrease inflammation and improve gut health. That helps with a lot of improvement of different symptoms. So that's kind of just about me.
Awesome. Well, let's start this talk by kind of differentiating between what is a food allergy and what is a food sensitivity.
Sure. Great question. I get this from a lot of my clients. A food allergy is a true anaphylactic allergy. So that means you are going to have lots of direct, quick inflammation to the point that you have anaphylaxis and need an EpiPen. Food sensitivities are different. Those types of symptoms are going to range from skin issues, migraines, arthritis, joint pain, that type of kind of realm of symptoms. And they are not life-threatening, but they definitely cause inflammation that can be detrimental to just everyday life.
Great, great. Yeah, I think it's very important to make that distinction. And then kind of a follow-up question, how do food sensitivities affect gut health?
Sure. So I'm going to go with an analogy here. Let's pretend we have a fire. Okay, it's like a bonfire. It's fall, right? And we're in the Midwest. When we have when we have a fire, okay, so we're going to think that fires are not great. We don't want fires, right? So, but when we do have a fire, a bonfire, it has some sort of fuel. Okay, and that fire is representing an overgrowth of bacteria, maybe some sort of H. pylori infection going on. There's a lot of different things that it can represent in our gut. And when we add fuel to that fire, which would be logs or grass or the right conditions of humidity, also logs, I think I mentioned that, any twigs, that is fueling the fire or the infection. And so when we're looking at gut health, we are looking at decreasing inflammation ASAP through our foods. So making sure that we're choosing foods that are specific to us, that are not fueling that fire, but then also addressing that fire, making sure we have a quote water can close by, making sure that we are, not having windy conditions. Those are going to be things that we would put the fire out, if you will. And typically I use that a lot of times with supplements. That sometimes we can do prescription medications as well. So not only do we want to decrease the fuel to the fire, we also want to put the fire out. So our gut health is just so important to our overall lifestyle because it can affect and create those symptoms throughout, our whole body, whether it be inflammation in our brain, migraines, inflammation in our skin, et cetera, et cetera.
Yeah, great. And that kind of leads into my next question. How would somebody know that they have food sensitivities? What are some of those symptoms that they might experience?
Sure. So it is a long list of symptoms that they could have. Food sensitivities are typically not developed overnight. Um, Here's another analogy for you. I call it the bucket analogy, and I explain this to every single client that I have. Our body has our own a bucket, okay, a virtual bucket, and that is our stress bucket. We have emotional stress, we have relationship stress, we have stress such as seasonal allergies, we have stress as in hospitalizations, maybe a stress of being a parent. And all of those go into our stress bucket. And we're doing fine with life until our bucket overflows. And when our bucket overflows, that is where symptoms come in. So symptoms vary from person to person. That could be, like I said, migraines. That could be lots of pain in our joints. That could be terrible pain in our bowels. Maybe we have loose stools or stools that are too hard. It can be, skin issues. If you go to my website, I explain all of my own journey through food sensitivities. I have no skin-based. So everybody is different, but any sort of inflammatory process like that typically is a root of food sensitivities. Food sensitivities are also a symptom of poor gut health. So once you address your gut health and you get it kind of back to baseline, most likely the foods that once bothered you will no longer bother you. So there's a lot of different things to kind of look at. That's not always the case, but it's always my goal to eliminate temporarily for clients and then to reintroduce. So we are widening the diet as wide as possible, as much as possible.
Yeah, yeah. That's awesome. I love whenever we can get to the root cause of somebody's symptoms or their condition. And it sounds like that's really what your goal is when you work with your clients.
Yes, and I will add that most of my clients have fired their mainstream PCPs, their GI docs, because they're so fed up with a quick band-aid of a medication that is not addressing the root cause. It's just putting a band-aid on and not necessarily even fixing their symptoms. So it's kind of a large population of my clientele has that kind of story.
Yeah, yeah. And like you said, there can be a long list of symptoms that someone might experience if they have poor gut health or food sensitivities. How do you determine that the gut or the food sensitivities is the root cause for that person? Are there particular testing that you do or a sort of protocol that you go through with your clients?
Sure. So I always start out with making my clients fill out a symptom survey. So it's a detailed questionnaire and it ranks different symptoms for 1 through 4. So, for instance, migraines. How often do you have migraines? 1 through 4. Very often, not very often, not at all. And there's a lot of different things that you kind of go through: dry eyes, itchy throat, et cetera, et cetera. So that's kind of the baseline. So I can really figure out what the symptoms are. And then from that, we do quality testing. So food sensitivities is kind of a buzzword, if you will, but there are a lot of definitely um, testings that are not necessarily gold standard. So a lot of ones that you're going to find online that are quick fixes and you can determine exactly what to eliminate. And some of those are feasible in price, but aren't going to give you long-term results. So I specifically use the MRT test. It fixed my symptoms along with some gut health work as well. And it also has done a great job at dealing with the clients that I work with in terms of different testing. There is IgE and IgG testing. Um, they can be helpful, but it's not as reliable as the MRT test. There's a lot of false positives in some of those tests and false negatives. So again, can be helpful, but isn't necessarily all inclusive.
Yeah, yeah. And I love that you bring that up. And I also think that it highlights the importance of if you do decide to take these tests, especially some of the commercial available ones, that you really take them and have them evaluated with a qualified health professional who can help you interpret them because they can be really difficult to interpret.
Right. There's a lot of gimmicky type tests out there, and it's heartbreaking when people spend money on that and they're not getting results. And so then they, you know, put aside the potential of having any food sensitivities because they had a bad experience with a poor test. Another test that I do is a stool test. It's self-administered, ships straight to the lab, and it is extremely helpful at looking at that, putting out the fire, if you will. So looking at those overgrowths, looking at poor microbiome, looking at digestion, looking at parasites, all those types of things. And those are, again, more of the deeper root cause. I kind of take it as first we're eliminating all the inflammation and then looking at that root cause. And it's both tests are very, very successful, very successful.
Yeah, great. And I want to go back to something you mentioned before, and I think it also ties into the testing that you were talking about having false positives. So meaning that if the test says that you're sensitive to one food, maybe you truly aren't. And that's what we mean by a false positive. But I just think that there could be people who cut a certain food out of their diet completely that they may not need to. And you mentioned earlier that maybe some of these dietary changes would only need to be temporary, and then later on you
Right.
can expand your diet. So I'd love to hear more about that and what clients could expect if they are working with you or another health professional on improving their gut health.
Sure. So just I'll give you an example. Dairy in and of itself can be really inflammatory for a lot of individuals, especially if they have poor gut health. So there are what we call tight junctions within our gut. This is a little bit sciencey for a second. I'll put up my fingers. There's some spaces here in between different cells in our GI system, and those spaces should be closed after at the age of about 1. Um, Back up for a second. When we are newborns, it is normal for breast milk to be able to pass straight through our gut and to be absorbed in the body. It's totally normal. But around the age of 1, those junctions close. And therefore, it is important for protein, especially, to be broken down in our gut before it's absorbed. So into smaller chunks, if you will. When we have some disruption in that gut lining they can be disrupted for a wealth of different reasons, maybe medications, stress. There's a lot of different things that could cause disruption. It's also kind of leaky gut is the buzzword for that. Gut permeability is the medical term for that. When we have potentially those open gap junctions, dairy can cause severe reactions, but it's not necessarily that we're sensitive to dairy. It's that we have poor gut health and we're not, addressing the actual issues within the gut. So I do remove dairy temporarily for some patients. When I say temporarily, that can be up to 2 weeks, that can be up to 6 months. And then we look at the stool test and address any sort of overgrowths or some issues in that gut lining. Once that gut lining is healed, the likelihood of us being able to tolerate dairy proteins is a lot higher. Within that, we're also looking at the quality of the dairy, where it's coming from, the type of milk that it is, the type of animal, et cetera, et cetera. So there's a lot of different things to look at there, but that's kind of the gist for some patients.
Yeah, great. Thank you for going into detail about that. Super helpful to get that picture. Um, I'm curious if you have any like patient examples, or I know you talked about, your own experiences on your website, but just the impact that working on your gut health can have for, like I said, either a client or a patient of yours or your own experience, some of those improvements that you've seen.
Sure. Oh gosh, what I do is so impactful. Like it's such a passion because I truly am changing lives, and it's very, very rewarding. I won't tell you my story because you can read that online. I will tell you a couple other patient stories. I'm trying to think here. I just finished working with a client who came to me severe migraines, to the point that she was on several different prescription medications. She could not go a day without taking them because she had so many migraines going on. She worked with me. Not only did she completely, she doesn't have to take anything for migraines anymore, which is huge. This is huge for patients. Um, she also is training for her first half marathon. So she went from on the couch miserable to being able to run and have minimal pain. Totally life changing. Another client that I've actually currently working with still, she had a lot of brain fog, diagnosed ADHD later in life, brain fog to the point that she thought she was going to lose her job as a professional, very very well, what am I trying to say? A professional, business professional. Lots of meetings, lots of communication with people, and her brain fog was just that intense. After working with me, brain fog is gone, totally gone. Really, really impressive. So it's very, very rewarding. That's just a couple stories. I've one other story. I worked with a client, and some of my clients I worked with for up to a year because it can take that long. I was able to get a diagnosis for her. Being a dietitian, I can't diagnose, but I gave her a couple of things. I'm like, I think you have this, specifically MCAS. It's kind of a new thing, mast cell activation syndrome. And sure enough, when she was tested at her provider, she had that. So just finding the answers for clients is huge for me, and so again, so rewarding. I love what I do.
Yeah, those are incredible stories. And yeah, like you said, life-changing, from going from not being able to tolerate much activity to running a half marathon. That's pretty incredible. Or to be feeling like you may lose your job to going back and functioning very well in your job is amazing. So that's amazing work. And you say it could be as long as a year, but really if you're looking at, your full life ahead of you, if you dedicate that 1 year to improving your health, then you're going to have those benefits for the rest of your life. So that's amazing, and I think well worth it.
Right. Completely agree.
Well, I've learned so much, and I think this has been super helpful. Do you have any like closing thoughts or other information you would like to share for our listeners?
Sure. I will just say that health is an investment. Our mainstream medicine that we have in the US is not conducive to necessarily finding root causes. Um, a lot of times going the quote natural route or holistic route is not necessarily the most cost effective, but when you're looking long term down the road, it is definitely cost effective. We are to eat to live, not live to eat. So having those mindsets and really looking at the quality of your life and how motivated you are, is going to be life changing for you, and it's going to have a great relationship too with your provider that you choose to make those changes.
Yeah, yeah, couldn't agree more. So again, thank you for this talk. I'm sure there are going to be people who are going to want to check out your website, read about your story, and maybe want to work with you. And if they do, how would they be able to get in touch?
Sure. The easiest way is just to go to my website, foodsensitivitydietitian.com. It's a little bit long, but very clear. You can also Google that as well, and I should populate. I am a one-man show as of now, so I have done my own website, so bear with it. It's not the most techy, but there's an option to click Work with Kristen, and you can send me a message there, and then I always provide a free 15-minute kind of introductory call, where you can ask your questions and things like that before we potentially get started to work together.
Perfect. All right. Well, thanks again.
Yes,
And
thank
thank you
you.
everybody for listening. And I will include that link to the website below in the description as well. So everybody has easy access to that. Um,
Awesome.
and yeah, I look forward to collaborating with you more in the future.
Yes, thank you so much for having me. I appreciate it.
You're welcome. All right.